All right, so welcome. My name is Megan Friedman. I'm a reporter with the New Haven Register and Hearst, Connecticut Media. It is 5 p.m. on March 24th, 2020. We are in the midst of an outbreak of coronavirus, which has required us to hold this interview remotely via a Zoom video call. I'm here with two Quinnipiac, I can never get the emphasis right, but Quinnipiac University professors. So you've got Dennis Brown, and you head the physician assistant program, correct?
That
and
is
specialize
correct.
in community health.
Yes.
And then Dwayne Boucaud is a virologist? Yeah.
Yep, virologist.
Virologist and a professor of biomedical sciences. Would you mind each just giving me a quick summary of what your background is and how COVID-19 so far has impacted your jobs?
I'll start. So my background is I'm a virologist. I came out of the University of Buffalo in upstate New York, and I've worked with human viruses for the last, for many years. I'm not going to date myself. But specifically, I haven't worked with the coronavirus, but with a group of viruses that are the DNA viruses. And so viruses act very similarly to each other in particular ways. And so I can definitely speak to some of that. And then there's some of the particulars, which I think in this virus are really special to it itself as far as communicability, et cetera. I think we can also speak to that one too. So I direct the Graduate Biomedical Sciences program at Quinnipiac University, and as well as teaching virology. And so we have a coronavirus update every lecture. So yeah, it's been a lot of
fun. And Dennis?
So I'm Dennis Brown. I'm the department chair and program director for the physician assistant program at Quinnipiac. I've been a PA for 30 years, mostly in emergency medicine, some community medicine, and emergency preparedness. My background is obviously emergency medicine then, as well as I teach a lot of the infectious disease and medical microbiology in the physician assistant program, and as well as my background in epidemiology and public health. So that's kind of a little bit about me.
Okay, great. Thank you both. So we've gotten a ton of questions coming in from readers, especially given how rapidly information about the virus is coming out and changing. So we thought it would just be a good idea to see which of those have answers at this point in time from experts. So here, I know I sent some of these to you, and I'll try to, I might skip around a little, but one thing is, what is the situation with COVID-19 in terms of immunity? Do you, once you get it, do you develop immunity? Do we know that yet? And if you have immunity, can you still be a carrier?
Okay, so I'll take that one. We don't know that yet, right? So the data isn't there yet. These are the kind of data that you get a little bit later on in an infectious cycle like this. So those studies aren't there yet. We're still looking at people who have gotten over the disease and seeing if they are being reinfected. Honestly, we don't know. Now, if it's like many other viruses, I would say that yes, you will probably have protective immunity. In many cases, when you're infected with something, it is very hard for you to be reinfected a second time because your immune system basically recognizes that, and you have a much more robust and full immune response to it the second or third or fourth time around. We can't say that for sure with COVID-19. Again, if it follows what we know about most types of viral infections out there, yes, you would be immune to a second infection. But again, we don't really know that right now.
And what about, is there a possibility that even if you do develop immunity, like with the flu, the virus could, if it sticks around, evolve?
Absolutely. So this is a type of virus which is known as an RNA virus, and the RNA viruses tend to evolve quite quickly. That's actually one of the things it shares with flu. Flu is an RNA virus also. So COVID-19 is an RNA virus. We can expect it to mutate quite readily. In fact, in some cases, they're looking right now at the virus that came out of China. So some of the early cases and folks who are now being infected, once we start looking at the sequence of those viruses, I would fully expect that there's going to be some slight changes. Are they substantial changes? Probably not this quickly, but I think that if the virus stays with us for a longer period of time, that yes, we can expect to see some sort of mutation. Will it be substantial? It's hard to say definitively, but I would expect that there is going to be some mutation. These types of viruses definitely do mutate over time.
And in terms of, I understand there's 2 different strains to the virus, but I'm not sure what that, in terms of the actual effect of that, what that means.
Yeah. So out of what happened, that work comes out of China, where there was 100 individuals who were tested. And they showed that 70% of the individuals had what they call the strain L and 30% had strain S. There's not much of a genetic difference between the two. And in some cases, some scientists are even kind of worried about calling it 2 different strains because it really doesn't have that significant difference between the 2 strains right now. As far as infection is concerned, where the data is not there, with only looking at 100 cases, really the data isn't there to say that one is more infectious than the other, or if it really makes a difference as far as the severity of disease, or if you're infected by one, does it help you not get the other? So we just don't have that data yet.
Got it. So switching gears just a little bit, in terms of the practical state of testing right now, how long is it taking for someone to get their test results back after you swab?
So most of the tests that we're doing right now are the ones that are out. You'll see a couple different ones that are run either through the State Department of Public Health. There are some private labs that are doing some of these testing, and they're looking at kind of some of the DNA sequencing, like Dwayne was talking about. So they look at some of those DNA testing, and that's how we're determining whether it is or isn't and it's more of a rapid, yes, it's there, or no, it's not there. And most of those right now, the turnaround time is about a 3 to 5 day time period. Now, the good news is the FDA about 2 or 3 days ago just approved a new rapid test for this virus, which will probably take a little bit of time before we see it in our communities because it takes time. They've got to get the approval, then they got to mass manufacture and ship it out. So to my understanding right now, I don't believe we have that testing in our communities. Most of them are taking 3 to 5 days.
Okay, and then say you do test positive, what, in terms of how contagious you are, what does that look like over the course of the disease? Do you stop being contagious when symptoms subside, or can you be contagious for longer, or do we even know yet?
So a lot of the things we're looking at are coming out of China and Italy and things like that, where we've actually had it for a while. You can't really base anything about what's going on in the United States just yet because we're still in the midst of the upclimb of this pandemic. But so the CDC, based on the data we're seeing, is pretty much saying that, with the current knowledge, if somebody has the disease, doesn't get tested, because right now there's limited testing. So a lot of people who are not in the high risk groups, not in the hospitalized groups, they're basically, in the endemic areas, like say right now in the Fairfield County of Connecticut, they're saying if you've got these symptoms, you probably got it. Stay home, stay there, don't infect anybody else. And you've got to go for a couple different criteria. CDC says you have to be fever-free without the use of medications like Motrin or Tylenol to keep fevers down for 72 hours. You have to be absence of the symptoms of cough, shortness of breath, things like that. Those have got to significantly have improved. Now, you may not get totally rid of it. It's like the flu. You sometimes get the cough with the flu and it lingers out for weeks and weeks and weeks. But it's not you're infectious with flu. It's your body is now healing itself. So that's the second of the criteria. And the third is you have to have at least 7 days since your symptoms started. So you have to have at least a minimum of 7 days there. And at that point, they're saying those who have not been tested, they're pretty much not contagious anymore. The only caveat with those who were tested is in some instances, and this isn't everyone, they may have you test again and want to see 2 negative tests within a 24-hour period. Now, do the math, it takes 3 days to get the test back. So it may take a while before you really determine that until we get these more rapid tests back or out there in the community. So that's kind of the symptomatology of when you can say, is it free? Am I now okay to go out into society and rejoin people and not infect them?
And they've also made a change in what symptoms could indicate that a patient might be developing COVID-19, right? They've added gastrointestinal symptoms.
So the studies that are out there, and actually the hospital that I currently do my clinical work at has added that on to the first symptoms they're starting to see now is in association with some GI symptoms, some nausea, vomiting, diarrhea, especially the diarrheal end, and then leading into the respiratory symptoms. So now we're starting to look at those as being, but it has to be one of the key, the number one key symptom is fever. You have to have fever associated with it. So don't think just because you had the bad food last night and you had a little bit of postprandial diarrhea that you've got COVID. You need to see the fever along with that. And then you see it develop there.
And how about for people in the medical profession who might be who might be vulnerable in some way? We got a question from a dentist. Someone said, I work in a dental practice which is open for routine cleanings and non-emergency procedures. I'm in the elder age bracket and have family with autoimmune issues. Should I be working? I'm guessing that you would sort of have a lot of that. Given how many people work in a hospital, you're bound to have some folks who are above 70 or who have family members at home who are immunocompromised. So what's the recommendation been for folks like that? Have they been sidelined, or does it vary?
It varies. So the recommendation is any at-risk people should do anything they can to reduce their risk to protect themselves from contracting the virus. So the steps would be distancing yourself from high-risk procedures, things like that. Now, it's not to say they can't work, but certainly if it's a dental hygienist, let's face it, that's a lot of respiratory secretions. So that's a little more of an exposure, and especially if you're not wearing a 95 mask, full protective gear to protect from getting into the mucous membranes of the eyes or the nose or things like that. So you got to follow what the professional organizations like the CDC, NIOSH, and even some of the, I'm sure the dental association and dental assistants have probably some guidelines out there, stances for people working. I can't say you shouldn't work, but I'm saying you should follow the expert opinions of separate yourself as much you can from exposure.
If I could chime in for one quick second here about testing. So there have been cases where folks are not presenting with a fever and still testing positive. And so we have to be very careful, because if you know that you have been in the presence of someone who is positive and you're worried about that and you call your doctor, the first thing your doctor is going to say is, do you have a fever? And if not, then they're not going to test you, okay? But I think under those circumstances, you should probably act as if you have been exposed, okay? Which means that you should probably sequester, because there are definitely cases of folks out there who have tested positive without fever or severe symptoms. And so I would say that it may be better to err on the side of caution, especially if you do have folks in your life who are above that or in that critical age. You may want to think twice about visiting them. So if you know you've been around someone who's been exposed, take serious precautions, even if you're not getting tested.
And in terms of general precautions for, folks who are healthy under 70, what sorts of activities are appropriate to do? We had someone ask, let's say you want to go over to a friend's house for dinner, and that friend takes it seriously, has been staying home, has been healthy. How do you make that call? Is there a right answer? Is it just going to depend on the individual, their circumstances?
So there's no perfect call on that. There's no right call, because the one thing I'll say in medicine and probably in most of sciences, you never say 100% sure it's safe, because you don't know. As Dwayne was just talking about, there's been cases of people who've tested positive who have not had full symptoms. Now there's a reason why they have social distancing. It's asking that we kind of avoid each other's in crowded areas so we can reduce that spread of this disease. And it's never 100%. You have to take into consider many different variables. What's the amount of time, how many people have been exposed, how many people are going to be there. There's just so many different things to think about. How many other people have been in and out of that house? Was there any recent travel to either you or them? So there's no right or wrong answer, and it's going to be a personal decision is what it's going to come down to for something like that. Also look at what is the state in your area. If there is a lot of cases in your area, then it's probably inadvisable to be doing anything like that. And that's where that social distancing should become more of the governor's stay home, stay safe type initiative, where you should be just kind of hunkering it in and staying there. Dwayne, if you have anything more on that.
Yeah, I'm one of those folks who thinks that it's really just best to err on the side of caution. We're seeing cases go up at a pretty quick rate in Connecticut and around the country, which means to me that that probably there are people who are asymptomatically spread, right? So when we see that kind of an increase, it means that you don't have to be coughing in order to spread this. And there's a lot of evidence that's showing that. So even though you may be feeling...
Sorry, I'm just going to stop you for 1 second. You're kind of going in and out a bit. I
Sure.
wonder, if you could just speak up a tiny bit. So you said...
Sure. So just to... there is evidence of asymptomatic spread, right? And so and when we're looking at the rates in the state that are going up so quickly, I think that helps prove that, right? So it is a personal decision. So if you're going over to that person's house, again, just like Dennis said, you have to think about, has anyone been in and out of that house? How many people have been in and out of your house? Are you bringing something to that person that they may not want? So you really have to think about that. Can you social distance while you're there? Social distancing, one of the things that they say is try to stay 6 feet away from someone. Can you do that in a house? I don't know. So that's one of the things you have to think about when you're making that decision.
And then what about seeing people outside? Is that safer in any way because, the air is moving? A lot of people have been going to state parks, and I'm wondering, is it a risk if you are passing people on trails, or is that being overly cautious? Yeah.
So it's all about the social distancing. And, if you're out there and walking on a trail, it's open air, it's not an enclosed environment, your risk of spread is much less. And that's not to say that if you see somebody coughing and sneezing, you definitely want to stay probably a little more than 6 feet away and take proper precautions. But it is safer out, and there's no reason you can't be out on the trails or things like that, as long as you're maintaining that distance. And that's the whole reason for doing it. And you got to get people outside a little bit. It's not like it's a contagion that's going to be, in the movies out there all over the place here. So.
And then on that note, does UV light from the sun kill COVID-19? That's something I had heard. I'm not sure the veracity of it.
So UV light is a pretty potent sterilant, but when we say something like that, we're really talking about shorter wavelength UV light, right? So UV light comes in a variety of wavelengths, and the wavelength that we get from the sun, you would really have to have a long exposure for that type of wavelength to kill off something like a virus. And so it's not something that, I mean, if you're thinking of putting some clothes out on the line and thinking that that would do it, if your clothes are out there for maybe a couple of days, maybe. But in most cases, you're not outside long enough for it to, like, it's not going to clear you up. That's for darn sure. So don't worry about that. So I don't think that it's really practical to think of sunlight as being an antiviral in this case. I just don't see how that would really work.
And also kind of on that note of how the virus can spread and what precautions to take. I know a lot of people have been worried about groceries, and if I get something at the grocery store, if I get an apple and then I eat that, is it possible that I could get the virus that way? Are there any extra precautions that we should be taking in terms of food cleanliness? I spoke to Dennis earlier, and he mentioned that we don't have enough data to know how long it stays on different surfaces.
There has been data to show that it does hold on to some surfaces really well, but those surfaces are really particular. So stainless steel, it can be on stainless steel for 3 days. I think cardboard for a couple of days. But I don't think any studies have been seeing on it in food products. I know hard plastic is another one it can be out there for 2 or 3 days on hard plastic. As far as being on foodstuffs, we don't have that data, but I think it's probably a good idea to at least wipe your food down anyway, right? To wash your fresh fruits and vegetables, definitely. And also to packaged food. I mean, I do know of some people who are wiping their packaged food down, but the data really we don't have that data to show whether it's going to be on that food or not. So.
Yeah, and I think the U.S. Department of Agriculture has also put out there that, and the CDC, there is absolutely no evidence of any spread of this disease from food product to a person. There has been absolutely no cases of that. So, but then again, you also, as Dwayne was saying, practice the basic things of cleaning, separating, chilling, cooking, and chilling. Those are the 4 things to help prevent any spread of anything, let alone coronavirus, salmonella, shigella, all sorts of wonderful other bacteria that can be in there as well. So.
Sorry, I was just taking a look to see what other questions I was hoping to get to. Oh yeah, so I mean, we talked a little bit about the sun as an antiviral, but what about one reader asked whether heat or a certain room temperature can help kill the virus in any sort of effective way?
So of course we know that if you boil your water, you're sterilizing your water, right? We know that if we heat surgical instruments to a certain temperature, we're definitely sterilizing, right? So that's really high heat. And so if you're talking about the heat that you live in your house, most likely you're not going to be killing off the virus to any specific degree. Again, there's no real data to show that, but I think on a practical sense, knowing what we know about other viruses and how they exist, and even bacteria, that your normal household heating is not nearly enough to kill off a disease-causing microbe. And so I wouldn't worry about that as far as an antiviral. I mean, when it comes down to like thinking about your garments, washing them in hot water is always a good idea. If you think that if you are COVID positive, it may be a good idea to definitely wash your garments in hot water, and your sheets, etc., all that good stuff. But as far as just your ambient household temperature, you're not going to get it high enough to really cause any harm to the virus.
So Dwayne, going off of what you just talked about with washing garments, so this is an envelope virus, which means that it's actually relatively easily killed by normal soaps and detergents and things like that in there. So, my understanding is we don't need to be rushing out and throwing bleach into everything.
No, actually, and Dennis brings up a really good point. The structure of the virus is really well killed off by warm soapy water. So washing your hands with warm soapy water, that will do it. And so regular detergents will definitely do it. Throwing bleach into your wash, not necessary. So regular warm soapy water in your detergents, etc., that will kill it off.
And then just a couple of other scenarios we got from readers. We had someone who said, my mom is 89, living in her own apartment. She's feeling great. I'm her caregiver, bringing her groceries and whatnot, since I will not be taking her out to any stores. Other than washing my hands and not having any direct contact, are there other precautions that I should be taking?
So first off, thank you for doing the right things. Washing your hands and not exposing your mom who's elderly, who could be potentially exposed to this. So thank you for doing that. The only other thing to add on to that is if you have any symptoms yourself, nausea, vomiting, diarrhea, like we talked about before, fever, cough, anything like that, then avoid. Obviously, don't neglect your mom. Have a contingency in place so that if you do start feeling ill, you have somebody else, another family member or neighbor, somebody who can do it for them without actually risking themselves as well. So I think that would be the only thing I would say. And if you have a pet, you're bringing your pet along, then I would probably caution against that, just in case you happen to get it on the pet's fur and the pet goes in and they pet it or something like that. Not that the pet's going to transmit it. It's kind of like a riding on the fur, if you will, to get in there. So
that actually, a different reader had sent in a question about whether there's any risk if your dog plays with someone else's dog, can it transfer via fur? So there we go. I think that answers that, unless you have anything to know. One more scenario here. I have a coworker who has a family member that may have been exposed to the virus. What should I be doing?
So there's no evidence that if the coworker had somebody who potentially might have been exposed and is not positive, the coworker doesn't have symptoms, what should you do? You should basically distance yourself and practice the social distancing. It doesn't mean you're going to get it. It means that you need to just kind of watch. There's been, that third related distancing person contact who may have, and I've seen that a couple times actually in the emergency room where they've had this, and it hasn't been, none of them that I've seen have been actually coming down with it. Now, if your coworker gets sick, then you should probably bring yourself in the home and self-quarantine yourself for about a 2-week period, 14 days, and watch and see if you get symptoms and monitor your temperature. If you have any other questions, you've got coronavirusct.org, I think it is, for the state one. There's also call 211. And if you start having symptoms, call your family provider, call your primary care, or call one of the urgent cares. A lot of them are setting up these, and even hospitals are setting up these telemedicine type things there. You can talk to them. Don't go rushing to the hospital. Don't go rushing into your family provider's office unless you're actually really ill. But the second and third distancing of somebody who may have been exposed is not something that's you're got it. Now, as Dwayne said, there have been positives that have been asymptomatic. So we got to just keep that in mind, but it doesn't mean automatically you've got it or you've been exposed.
Right. And in that vein, it's a scary time for healthcare workers. What else can people do to protect them and help them out?
First, don't go out and buy the world's stock of the N95 or 3M masks, because we need those on the front line, not sitting in the painters' garages. I would say if you don't have to go in, don't expose your healthcare providers to it. Call them. Call first. If you are really ill and you have to, call an ambulance, but let them know the symptoms you have. And if you do have to feel you have to go in, let them know ahead of time before you walk in. So whether it's calling or whatever, because a lot of places have triage systems set up to actually prevent people from walking in and contaminating everybody else. Dwayne?
Yeah, I just would say, I would want to reiterate, unless you're feeling ill, don't go in. Unless you are you have that fever, you're in respiratory distress, I would seriously consider not going in.
Sorry, you're cutting in and out again.
Yep, I would say unless you're feeling that respiratory distress or you have that fever, don't go in. Don't go in on a whim, really. If you're just feeling under the weather, stay at home, hunker down, and get through it that way. Because even if you are positive and you're not in that vulnerable population, you going in exposes the healthcare workers who are now dealing with that vulnerable population, right? And so if you can weather it at home, I would definitely say do that without going in.
One of the other things with healthcare workers that we're seeing now a lot of, and it's coming a lot from Italy, there's some from China, and actually here in the United States, is healthcare workers on the front line, the emergency people, the intensive care people. The more exposures they're getting to these virus, the increase their load, and we're actually seeing healthy young healthcare workers becoming very ill with it. So keep that exposure to them down as much as possible, and it's an accumulative viral load that will do this to them.
So the extent of exposure does make a difference in this case. We saw that doctor in China, right, who was quite young, and he was considered the whistleblower, and he died from it. Was that likely because of how intense of an exposure he had to the viral load?
Well, not just the intensity, but the amount over time. So time with exposure, without distancing, without any protection, that's where you're going to get your exposures. And exposure over time is what's going to lead to probably the increasing viral load on him. 1-2 persons, probably not, but over time of taking care of hundreds, yes.
Anything major that you each would like to add? I'm sure that there will be more questions in the future as this thing progresses and we see new data coming out, but any other takeaways for people wondering how to handle this and wondering what to expect?
I would say it's going to be a challenging time for a lot of people. It's going to be trying times, and it's going to upset our normal workflows. It's going to upset our normal lifestyles. But listen to what people are saying. Like the governor said, stay home, stay safe. There's actually truth in that, and it's not bad advice, and follow that advice.
I would also say be prepared for this to drag on. We are seeing a pretty substantial increase in cases, and I don't see that. And everyone's talking about the curve, right? The curve is not close to flattening out yet. So just be prepared to keep going on with this. We just saw that now kids are going to be home until April 20th, right? And April 20th, they're going to have to reevaluate. And so we may see them staying home longer than that. I would just say, be prepared for that, whether it's emotionally, whether it's whatever it takes, just be prepared.
Well, I think Lamont even said this morning, he gave April 20th last night, and then he said it's even more likely that they won't be back to school till the fall. So,
in most of the universities, we've extended it out the entire semester they're gone. So we're adjusting to teaching online now, which is a whole new thing for us. So that's been a challenge in 1 week time, but so that's what we're doing, and we're actually planning it may even extend in towards the summer. So,
yeah. Well, thank you both so much, and thanks for helping to educate people both with your students and through this video call. I'm gonna wrap the recording right now.
You're welcome, by the way. Thank you. This has been great.
Yes.